that's a concern. Again, I'm not taking anything away from these requested positions or anything like that. But when I look at our little brochures that go out to the taxpayers, where your dollar goes, our general government in the 16-17 budget was 20%. And when I look at the general government 2021, it's 31%. So that's an 11% increase over that short, I'll just say 5 budgets. And it's a concern. Public education and public safety have always ranked pretty much at the top, which I think showed the board's position on priorities. And so when we move the other, did you have a copy of that? General government moves up, and then these two very important components of the budget move down. So I'm just expressing a concern over that. Again, not taken away from any of the requests, because department heads have a feel for what their needs are, but just expressing a concern about how Person County tax dollars are spent. Now, you've got what you need to.
What we've distributed is just a draft of the job description that we had worked on some time ago related to the public information officer. So this was focusing on external communications for the county, helping to tell the county government story and assist departments with getting news out about what they're working on. So I'm not going to go through all of the duties there, but you can take a look at what some of those some of those consisted of.
Who would this person report to?
I think the board had requested in prior discussions that it report to the county manager's office. It would just be another employee within, and that's where we have it budgeted, in the administration budget.
And this position would cover all departments within county government. So one of the things that I was led to believe was a lot of the department heads have to update information, trying to get information out to the public. Because one of the big complaints that the public has brought to me was that we don't know what the government's doing. We don't know what's going on. We don't know what programs are available. Our old website wasn't very efficient. The new one was much better for distributing information, but department heads to upload their information could spend several hours a day or a week away from their primary duties, just trying to gather information and upload it to a website, which to me takes away from their actual work. So how you quantify that in terms of hours and dollars, I'm not sure. There's probably a way that someone would do that, but to have someone that's primary responsibility is to gather information on what all departments are doing, what programs are available, and getting it out not only to the public, but to staff. There's no way anyone can know everything that's going on in county government. It's impossible. So I'm just thinking we're living in a day and age where I don't know of many governments or agencies or police forces that don't have a public information officer. And I agree with you, Gordon. I don't like the growth of government at all. And I think our primary focus is, what is the primary purpose of government? Why are we even here? What is the primary purpose of what we're supposed to be doing and doing for the public from that standpoint, that the half things and then the nice things that we like to do.
It's service, first and foremost. How would a person in this position handle social media and either misinformation or disinformation?
That's subjective.
We're hoping to have,
That's
Yeah.
subjective.
Sure it is. Well, who decides then what's truth and what's,
Well, if they're working for the government, for the county government, they're putting out information from the government. I mean, that has to be accurate.
I agree, tell it like it is. Be factual and actual in it, but that's a huge problem. It's a huge problem in our community. Either or, I don't know which word is the correct word, disinformation or misinformation. What you read
What are you referring to?
on things that show up on social media, Facebook.
On
I
the
call it-
county website, on the county
Oh,
site?
no, this person county local and,
Well, that's not our
Yeah.
problem. The problem,
Well, I think it
our
is
focus
our
is what we put out.
I think it's a driving factor in Person County government and what goes on. I mean, from my perspective, it's gossip. But,
And that's nothing new. It's been around
Oh, no.
for ages.
well, it just moves much faster than it used to.
That's true, it does.
But would a person like that deal with that type of information?
well, we're looking to have a coordinator of sort of central messages and funneling social media through this person. Just to help coordinate, because right now, all the departments are doing their own,
Yeah.
media releases are coming separately from each department. And so trying to have just a coordinator of information was the intention of the position. The board had asked staff to develop this position, so that's what we are bringing to you.
Well, I kind of agree with Gordon a little bit on that. We need someone, when things are posted or not true, and somewhere where they can go. And basically, this is where the truth is. All the rumors and things that fly around, if we have a public information officer putting the information from the county government, which is actual and factual, then that's where people can go. You're not going to stop people going to Facebook and social media and starting rumors and things like that. But if anybody comes up and makes accusations and things of that nature, certainly they can go back to the public information officer wherever they post their information, which I'm assuming will be on the website. That's where someone can go and get the actual information.
Good reason not to have social media.
Too late now.
Yep.
Not for me.
Hmm?
Not for me. I don't have.
No,
Where did you get salary starting figure?
We, for all of our positions, typically have our human resources department survey a regional market for us of similar positions. And then we
Okay.
try to, figure out what the market rate looks like. So that's the minimum salary, plus this includes benefits as well. And part of the need for this position has also been driven by the number of public records requests that we have been receiving. This person would help coordinate that between the manager and the attorney. That has really taken a lot of staff time to respond to those. And there's also a role for this person in emergency and crisis management. When we're having emergency operations centers, this would give us a person who could help handle the media inquiries and help the internal and external communication in those situations.
You just want to go down the list here and
It is entirely
explain,
at the pleasure of the board.
or do you want to take these one by one?
There are specific ones you want to focus on, we can do that, or we can go through each and every one of them.
I mean, we've already had your one-on-one meeting of you going down one by one. I with each one of us, I think, at this time. If a commissioner wants to point out a particular position, have discussion on it, this would be appropriate time. I don't see going line by line item necessary at this point.
I agree.
I just have a couple questions on the administrative assistant for HR.
Yes,
Is that something new that's developed?
it is new. Yes. So
For the reasoning being,
the reasoning being is that they needed some additional help with the basic administrative tasks in that department. There is a statistic or a benchmark that the professional HR standards say that it's one full-time employee per 100 employees. And so right now we have a director and 2 other positions that are supporting HR, an assistant director and then an HR specialist. We also have our safety and risk management position under HR, but they're not actually performing HR related duties. They're focusing on coordinating risk management for all county departments. So we're slightly understaffed there with just the 3 staff members, given the size of our organization. This person would help with posting jobs on NeoGov, would help with background checks and reference checks for new employees. A lot of filing needs are in place there. So just sort of basic admin positions or duties is what this position would cover.
so close to $1 million in new positions.
Yes.
Is this environmental health, I'm sorry,
Go ahead.
environmental health specialist, is this in addition to the ones that we've already approved previously?
Right. This
Okay.
would be an additional position that's taking them back to the staffing levels that we've had in the past. They have a new director in place and her background is not necessarily in the well and septic inspection services. So we are hoping to have a specialist who could help with those duties, helping the backlog that you all are familiar with. I think we're still 10 to 12 weeks
Mhm.
out. I know Janet is here if you'd like to hear more specifically what the position would cover or what the needs are.
Yeah, I just was clarifying that it was in addition
It
to what
is
we
an
already
additional.
approved so I'm like that,
Yes.
yeah.
Yes.
Finance technician.
Yeah, we talked a little bit at your retreat about the need for some additional assistance in finance with some of the new reporting requirements with the ARP funds, with the audit requirements. And so we have a part-time position currently in this role that we would like to make full-time
Mhm.
to assist with some of those reporting duties. And please, department heads, if I am missing something crucial that you'd like the board to know, please feel free to speak up and help us.
About the deputy director, DSS. That's something totally new.
Yes, all of these positions are brand new
Mhm.
positions. So the deputy director, DSS is one of our largest departments at nearly 100 full-time employees. They do not have a deputy director. And so Carlton is taking the opportunity to try to restructure and reorganize social services and could use some assistance in the span of control or the supervision of some of his division directors.
I'll look at this position as being someone who would be able, if something were to happen to Carlton or whatever, that person would be able to come in and step in and fill that role,
Right.
his position.
Going down the list of DSS, the last one, income maintenance investigator.
Mhm.
Who-
I'm gonna pull my description of that, Carlton, if you don't mind coming up and helping me address that one. I just need to turn to that.
Afternoon.
You go ahead.
Okay, sure. So at First County Social Services, at all counties and social services, there's a fraud investigator. So we've always heard of people abusing food stamps, selling food stamps, or stating that they're not married, which they are married, and trying to get Medicaid and things of that nature. There was a lot of funding and things that make sure that we are in Person County because of the pandemic right now. We're getting about average around about $1.7 million a month just in food stamps, and over a year's period of time, about $65 million or so. A lot of times we've had the local Roxborough Police Department actually bring a bunch of the FNS cards that they got at a drug bust because people are selling food stamps to get cash in order to buy drugs. We have one position right now as the lead worker for Food and Nutrition Services, FNS, and food stamps. Part of our job duty is fraud. We currently do not have anyone to really do that work in the Medicaid area as we're supposed to. We have to have a plan with our local DA's office as well as the state with how we're going to deal with fraud when cases go to court and things of that nature. And just a little bit of numbers, just so you know. So we have in the 2000, and this is some time ago because we lost some data due to the cyber incident. But back in 2017, 2018, the county recovered $57,886 in fraud. In 2018, 2019 fiscal year, the county recovered $60,214 in fraud. This is just in the FNS and Medicaid programs, but the majority of it has been in FNS. With a full-time investigator, we can really have someone to do some work and make sure that people are not basically stealing benefits from the county and state.
When you recover the funds, where are they recovered from? Where you-
So what happens, they have to go to court and they have to pay that money back. Or if they still qualify for fund, instead of receiving that funding, if it goes to them, it comes back to the county.
Mhm. Is there a default on that? A percentage of default? I mean, you can get a lawsuit and win, but that doesn't necessarily mean you collect.
Correct.
So
But
was there?
I'm not exactly sure about that
Uh-huh.
plan because I do need to get back with the DA's office with the new DA about with that, but these were actually collected that we did receive.
Okay.
That's my understanding. We did verify that.
Thank you.
You're welcome.
This is a state mandated
Yes,
job.
sir. It is. Yes, sir. It is.
Any other questions on the recommended list of Mr. Perry? Thank you.
Thank you all.
Thank you.
Anything else on positions that you'd like to discuss?
I would like to bring up a little topic. I spoke with several EMS, EMT personnel last night. And I was unaware, I knew that we were short on staff, but I didn't have a clue that, just say they make a radio call, they're out of truck. And I don't know what that verbiage means, other than maybe I'm out of duty, I'm eating, it's time to sleep. I don't know, but they're calling in out of county EMS and EMTs to come serve Person County.
Yes.
This is something that's new.
Not
My
new.
understanding.
Unfortunately, it's not new.
Not, wow,
There's a slide
shocking.
that I presented with the budget on the number of times that a truck is unavailable to respond.
right.
And Tom is here with some data to share. Later on the agenda, we wanted to spend a little time talking about the EMS budget.
Okay.
And some of the instances where we're seeing, the trend of timing, that we're unable to respond,
Okay.
continuing to grow. So that is a real serious concern.
Absolutely.
And we are
Absolutely.
leaning on neighboring counties to help provide
Yeah.
coverage when we are out of county transports.
Need to cover it in depth. as when time comes.
Anything on the not recommended list that anyone wants to discuss there? Comments, Ms. York, or you'll move on?
I'm just available to answer questions if you have them related to personnel requests. I think the gist that I had gotten in my meetings with all of you was that this was a lot of positions and you weren't really keen on that. So this is the opportunity to try to better understand the needs and make some adjustments as the board sees fit. Just to kind of tell you what we were thinking is that we would get your feedback today. On Thursday, if we have another work session as planned, we could give you a list of those adjustments. We have like a running calculator tool that will show you the reductions that you've made or the additions that you have made and make sure that we have a running tally to make sure that the budget is balanced. So once we get any adjustments that you'd like to make, we can bring those back and show you the offsets and the overall budget picture.
So question here, who has been running a recreation program specialist position?
Well, these are new positions,
I
so
mean,
these
but
are,
somebody, that this has been available, that the recreation has been here. So who's been
Sure.
handling,
well, the current staff is handling it, but because they
and
had
not
some,
one specific person, it's just kind of spread out?
right, this was a request for a new position that would help some of the growth that is planned with the projects in both the CIP and some other board initiatives where we were adding parks potentially. And so in a further discussion with John, we decided that, yes, this position would be needed, but the timing just didn't really align to need it fully staffed at this point in time. So I suspect that you'll have this request come back next year when we're ready to start staffing some of those additional needs.
But for these parks, I believe will be up and running in the next couple of years.
Should be within the next budget year.
Yes.
Fully operating, partially operating before then.
Yep. So there'll be some staffing needs with,
Right.
increasing the workload for the department.
I should have known that.
That's right.
I have a question on the EMTs. Are we fully staffed with our EMTs? Are we short? These are new positions
Tom, I'd
here,
like you
right?
to come
These
up
are,
and
these are
help me
new
with that.
positions.
These are brand new
Okay.
positions.
So,
Yes.
where are we at with the staffing on those now?
So as of right now, as far as our current staffing is concerned, we have 3 paramedic positions that are open, and we have 3 EMT positions that are open. Friday, we just did interviews to hire more staff to fill those vacancies. We also do have some anticipated promotions that are coming up because we've lost a lot of leadership positions within the organization. So as people promote up, that's going to create additional positions as well.
Yeah, additional vacancies.
Correct.
So the paramedic positions, the intention is to add 1 paramedic per shift.
Correct.
Do you want to talk a little bit
Sure.
about the standard that is required for that and that versus what we are currently staffing?
Sure. So our current staffing model today is on an ideal day, we have 1 supervisor and 4 staff trucks. I can tell you that standard is very hard to meet right now due to staffing issues. So the reason for adding the additional paramedic to the position is to allow us some flexibility to basically keep trucks staffed. The issue that we're having is, and this is part of a much larger discussion, but because it's taking us so long to train individuals and get them released, because we're having to hire individuals with much less experience than we've typically been able to do in the past, then the training process is extremely stretched out. So when we lose an individual, it's a really long time for that position to be filled because we can't just hire somebody and put them in that position. We end up having to train them basically from scratch to fill that position. So the reason for the 4 additional positions is to decompress us a little bit so that we can train those individuals and train those individuals adequately. The other concern to me is the northern end of the county, and that was in the presentation that was presented to you. In the northern end of the county, our response times are very long to get up to the northern end of the county. That additional paramedic position allows us to staff a paramedic in a response vehicle up in the northern end of the county so that when we have calls up there, we can get people on scene quicker. I know you're debating the fire tax right now, right? So those individuals, those first responders are critical to our chain of survival and success. However, they are not providing advanced level care. These paramedics provide an advanced level of care that those first responders cannot. So I'm fully supportive of the fire tax. I just want to throw that out there. I'm fully supportive of those positions, but there's a skill set that we still need on top of those positions, and those 4 paramedic positions allow us to do that.
Where would that person be housed?
We're still working on that. In the CIP budget, we have money set aside to either basically look for a building of opportunity. We will work with our volunteer fire departments to see if we can house a unit there. If we can't do that, then we will look for a place of opportunity. That being said, it is not uncommon in our business to post a truck at a public location, whether that be a store, whether that be an intersection. It is not uncommon in our business to just post a truck in a specific area if that's where the call volume dictates.
I was told last night by one of the young ladies I was speaking with that some of the new hires that we get, they get their training, then they take off to another county and make 20 and 30 more grand.
That is correct, sir.
How can we put a halt to this?
He's prepared. Pay their money.
I mean,
So
maybe it's contractual.
So there's a couple of issues there. The first issue, as I alluded to before, it's very hard to hire people. We are talking a very shallow applicant pool for us to hire from, and everybody is in the same boat. This isn't a local problem. This is a national problem.
Right.
So everybody's in the same boat. So in the slide deck I gave you, and I'm happy to jump ahead if you would like, there's a bidding war going on right now for EMS providers in the region. It started with one jurisdiction, basically starting their paramedics at $10 more an hour than we're able to hire our paramedics. And everybody's just joining in and they're stacking on top of it. So it's creating a bidding war in the region. So even if we get these individuals in again, and we're hiring people with much less experience than we've hired in the past, it's taking us 6-9 months to train them to a minimal level so that they can perform. And then, yeah, why not go next door where I can make $10 an hour more? Why would I not do that? Or more,
Durham
yes.
County's- Orange County's moving their pay scale up to 20 grand.
Yes, sir. And again, I have a slide for you that lays all of that out for you.
Well,
Compared to first.
my thoughts on this is that even with these 4 positions, you got 3 that are open. I think you can continually have an open position for EMTs is on down the road. I just don't know. I don't think we'll see it. I'll be surprised. But I don't think we'll ever see, when you've got 3 short now and 4 here, we'll have 7 EMTs here employed, at the same time. I think we're gonna, it's one of those positions that you're always probably gonna have an opening or 2 to fill.
And I agree with you, sir. Again, it's a little bit of a revolving door right now. The issue is that when I lose somebody, if I don't have somebody to move up into that slot, it's taking me 6, 9, 12 months to get somebody trained to fill that slot. So
Right.
that impacts the rest of the staff because we're continuing to overwork our staff. We're continuing to burn out our staff. Therefore, they're continuing to leave because we don't have the capability to give them any respite.
What's the cost of training?
So the
Wait.
cost of training is all internal. I mean,
Right.
there is a cost to training as far as them going to school and that kind of stuff. But the training internally is, in order for me to train this individual, more times than not, I'm having to pay somebody overtime to train that individual.
So I guess what I'm looking for is when you're looking at, should we pay we should still train people, but if we paid somebody more, versus continually training, that there's a certain portion of that budget money that you're spending over and over and over again. If you could have better retention, probably maybe we'd get rid of some of that cost and it would be somewhat of an offset, not having to pay for the excess training. Besides money, what are the other factors? I mean, because money is a big motivator for people to work, but they also do it for job satisfaction or where they want to live and things like that. So are there other things that are driving people out?
Absolutely. So I don't think we as a nation have really grasped the impact of COVID that it's had on our workforce. And again, some of the information that I provided to you, there are states out there that have seen like a 60% reduction in their EMS workforce. People are just leaving the profession.
Mhm.
And I won't name a particular institution, but our medics could leave today, go work in a hospital, set their own hours, not have nearly as much stress, not have nearly as much, you get to pick your differentials, you get to, pick and choose what you want to do. They're leaving the profession. So there are a couple of things that we're working on internally to improve that. One of those is just improving the culture of the organization, right? So we had, over the last 7 years, we've had a mass exodus in leadership within the organization. I have a particular shift. The average age on that shift is 22 years old. That's the average age on that shift. We have lost a lot of leadership. So one of the things that we are trying to do right now is build a better culture within the organization so that people will want to stay, people will want to be there. We have some very young, clinically aggressive individuals, and they are trying really hard to do the best they can to keep us clinically progressive so that we're where we need to be medically. My concern as we're moving down the road but at the same time, we're burning these people out. So if we want to keep them, we've got to find a balance where they do get some respite. And to Commissioner Palmer's comment, we don't have trucks out of service because people are eating dinner or people are taking it out. That's not why we have trucks out of service. We have trucks out of service because I have all 4 trucks on the road. We have additional calls for service and I don't have anyone to send. Anecdotally, Saturday, I ran 2 calls from home on Saturday because we were completely out of trucks. So it's not I wish it was that simple. I really do. But the reality is as our call for service has gone up, and our call for service has gone up over the last 5 years, about 500 calls a year is what our call for service has gone up. The demand per year. So the demand is higher, but we've not changed our staffing model since 2017.
Is the 63,217 that the starting salary for this position?
That 63,217 includes your medical insurance, FICA, retirement. So that is not the starting pay. That's what it will cost the county to put this position into the budget.
Okay.
Yeah.
I mean, personally, I think there's a need, and I know we need to. Right now, we have a shortage, and certainly, I just was going to ask some questions about that, but I don't have a problem with these positions at all. As I said, I just think it's going to be very difficult for you and for us to get all these positions filled. We're going to be competing with everyone else around this county. So
I just want to call your attention to one of Tom's slides in the corner. He has it titled Wage War. You can see the yellow highlight on person. That has the minimum pay that you're asking about, Commissioner Sims, for both the EMT and the paramedic. So person right now is ranked like the 3rd lowest. The chart is organized from least amount of pay to most amount of pay. And that includes all of our regional partners. Just so you can see how person's pay ranks and why we're struggling to compete with these other counties.
And if you don't mind, just to address this specific slide, it is just super competitive right now. And so part of the reason that we're maybe bringing this to you today, where maybe you would have liked to have heard this 2 months ago, is this wage war is continuing right now. So I meet regularly with all the regional chiefs in the area, and we openly discuss this. We openly discuss what we're doing. However, there is no gentleman's agreement that we're not going to poach from each other, right? So the reality is we discuss it, but everybody is facing the same thing. And I'm going to use Wake County down there at the bottom just as an example, because they kind of started this wage war, and I mean that with no disrespect whatsoever, right? They saw that they had a need and they moved their starting pay to $28 an hour. We're currently paying $18.62. That's what we're paying in our starting pay per hour.
1862.
$18.62. That is
You
currently.
did
what-
at McDonald's almost.
Yes, sir, I'm aware of that. Okay, so then what has happened is all the neighboring partners have now kind of piled on.
Yeah.
Johnston County, for example, gave their EMTs and paramedics a 40% increase, salary increase this year. That's unheard of, if you think about it, 40% salary increase. So once Johnston made their move, Durham County made their move. At their Board of Commissioners meeting a couple of weeks ago, they added $2 million to the EMS salary budget. Okay. In talking to the chief in Durham, he said, we will be competitive, if not slightly more than Johnston County and Wake County. Now, they're still looking at what does that implementation look like. So he can't give it to me specifically what the hourly rates are going to be, but he has told me we will be at least as competitive, if not more competitive than Wake County. And then we've heard that Orange County has also made salary increases. And if I remember, basically what they have posted is that 74% of their EMS staff will get a salary increase this year. It's on a sliding scale, so I can't tell you exactly what that's going to look like because they're still kind of working through that themselves. We've heard that Guilford and Alamance are also looking at increasing their salary rates as well. So we may be third from the bottom right now. I don't know what that's going to look like come July 1, once all these budgets are approved.
So some strategies we've talked about is that there is a compensation study included in the budget, but the timing on that, it's going to be a while before employees start to feel any real effects of that. So Tom and I talked about doing a set aside in the upcoming budget of about 10% for EMS salaries so that we could do an adjustment on our EMS salaries sooner rather than later in an
In the
attempt
fiscal
to-
year, during fiscal year.
It's during the start of the fiscal
Okay.
year. Yeah, because if we start the study in July,
Mhm.
that's for all county positions.
Right.
I think you're probably looking at about 9 months before you have the results in hand and recommendations vetted to figure out exactly how you're going to pay to implement that. And I'm not sure you want to wait that long for something as dire as EMS.
No.
And it could be outdated by the time we get it. It's just unprecedented inflationary pressures going on everywhere in the private sector as well as in the
Sure.
government sector. So, I mean, that 9 months study data could be very old.
And, I do want to just point out that at least what I'm recommending is not necessarily in the recommendation specifically, is that this salary is basically for captain levels and below. This is not for the chief's salary. It's not for my salary. It's for the folks that are boots on the ground that are actually doing the work. That's what the intent of this is for.
So you asked for $180,000 to be in addition to the recommended budget. And the 180,000 would be put into reserve.
We could do it a number of ways. We could put it in contingency, the undesignated contingency with the earmark for EMS salaries. That would probably be the cleanest way.
What happens at the end of the fiscal year if there's funds remaining then?
Well, generally, if there are any funds remaining, that is what contributes to your fund balance growth for the next year. But in
Could that-
EMS cases,
Could that
we
be
have-
could that be liquidated back into EMS?
you would just make an appropriation from fund
Okay.
balance next year. We have pretty much rated lap salary funds at this point to cover overtime needs and part-time demands for his budget.
I think on the bottom of the first page, there's a graph that's showing you overtime. That's basically for 2021 and year-to-date 2022 is what that's showing you. And you can see what our overtime costs are right now. And that is just at a minimum, trying to keep the minimum number of trucks on the road. That is what that overtime is. And again, as we discussed earlier, that's also training to train new individuals. So that's what that overtime is coming from.
Right, if that trend continues, you're talking about $1 million a year, almost, to cover overtime.
Now, how often would you give us a report on when that contingency funds would need to be used? When would it be implemented?
Well, I think we want to have some time to look at salaries and figure out a plan that would benefit the employees most. So we
Wow.
could bring that, I don't know, probably in July, I would think.
You'll bring it to me in July?
Staff will bring it to you in July.
That's what I was getting ready to say. Wait a minute. She's sticking around longer.
You know, but
We've been working on some
um,
plans.
I would think July, end of July, that'd be good, but Mr. Chairman, if we're all in agreement with this, I would like to take $180,000 out of fund balance and designate it to designated contingency specifically for EMS.
Thank you. That will help.
I mean, that's, if everybody's,
I'm in agreement.
I'm in
Okay,
agreement.
okay.
Is that a motion? Is that a proper motion?
I don't know, Charlie, that's a way of making everything better in person.
There you go.
That's how we keep
That's right.
convincing everything's better in person.
Tom, is there anything we didn't cover that you wanted to hit on related to I think that was our third agenda item, EMS budget?
Yeah, other than saying thank you for listening, and, Manager York mentioned the $1 million overtime. I just don't want to underemphasize that it's to go with what Commissioner Gentry said. It's just not about the money. It's about improving the organization, so it is better in
Quality
person,
of
right?
service,
Because
yeah.
that's what we're trying to do. We
Right.
also want to make sure that we're maintaining the appropriate level of service for our citizens. But, EMS is a tough job. I've been doing it for about 30 years. It's a tough job. And I was reading something recently that said an average adult basically experiences 3 to 5 significantly traumatic events in their lifetime. Okay. For EMS providers, that's 400 to 500 significantly traumatic events in their lifetime. So bringing people in, allowing our people to get some respite allows them to deal with that trauma that they're carrying around with them. Because if we don't address it, we're going to lose on it. And I've been involved in 2 agencies that had providers commit suicide because they finally just couldn't do the work anymore. I don't want to see that happen in this organization.
I hope we can get the help. I hope we can get the staffing. Again, you get the staffing, then you can reduce the overtime. So that's important.
Thank you all very much.
Thank you,
Thank
Sean.
you.
Great job.
Move on to the person industries.
Yeah. Commissioner Gentry had asked for a discussion of person industries in terms of what it's costing the county and what those trends are looking like. So I have our person industries director, Amanda Everett, available to answer any questions that you all have about the budget. The person industries budget is found on page 135 of the budget document. It's not in the general fund, it's a special revenue fund towards the back. If you want to refer to that, but she's prepared to answer any questions that the board might have.
Good afternoon.
Good
Afternoon.
How are you doing?
I'm well, how are you?
I'm great.
There's 2 components to her budget. One is person industries, one is MRF, the material recycling facility. If you'll specify which ones of those you want to focus on, we can get to the right page.
What I'm most curious about is the expenditures. They were up
Mhm.
substantially.
the expenditures
this
were up.
past year? It says for 2022, 21, 22, the adopted budget and the request. So I'm just looking at the executives, the expenditure summary by department. So just curious
What
about
page is
that.
Up
Page
towards the front.
29, I was on
Thanks.
page 29.
Okay.
So as far as my requested budget, in my line by line item, I had no increases in that. And that must have come from our increase in medical funds, salary lines, those type of things, because as far as I'm aware, other than the feasibility study that was included in the MRF budget,
Mhm.
there was no other substantial increases on my part as far as like everyday spending or supplies,
Mhm.
operating of the department.
Okay, so that was my question. I didn't understand why it looked like that on page 29, but on page 136, it shows a negative growth. So, I
It's
mean, that's
actually
good.
negative on here too.
Mhm.
You
Yeah.
might be looking at the wrong line. The
Yeah,
person
so
industries
negative
is,
168,
We-
630. Then person, and then recycling facilities, negative,
He's
decrease
down,
of
yeah.
7,173.
it's down almost 8% on the PI side,
Mhm.
and then 1% reduction on the recycling facility.
So what's happening with the merger of the facilities?
It's
How's it coming along?
It's coming along very well. The feasibility study, we're coming in at a close with that. We just got 2 layouts of the additions that can be put on over at the recycling center, 2 options that we can go with. And so I've actually been out on medical leave. I go Thursday for my post-op appointment, so I can officially come back to work on Monday. And I have meetings set up next week to speak with our company that we're going with. His name is Matt Todd with RRS. And so they have gotten an architect involved, and they're bringing in all of that to be able to, because what we really wanted to do and really focus on was us no longer being 2 separate entities. We wanted to be able to pull us all together, and they are giving us a really great opportunity for that. So we just got those drawings the other day, and hopefully we'll have
Great.
everything finalized up by the end of the fiscal year.
Okay, when the lease is up on that building, the net savings is,
Unfortunately, it's not much. The rental rate on that facility is about $13,000 annually.
okay.
Yeah,
Well,
but there will be
$13,000
some,
But it
Still.
will be the other,
some
some
efficiency
the operating
improvements.
and
Yeah.
all of that information, and then the traveling that we do back and forth, and
the gas
the
expense.
oh goodness, yes, getting employees and consumers from one building to the other.
Right.
We'll all be in one location under one roof, and we will be provide services even more efficiently.
And so that'll come before the board, probably this summer sometime.
Yes, once we get everything finalized and situated, and I have a full plan, they're willing to come and present with me.
Okay,
And with a slideshow that you can see all of the details of
Drawings and
everything. But
everything,
yes,
yes,
but it's very exciting on my end.
is that including all the new equipment that you were
Yes, ma'am.
wanting to implement? Okay.
Yes, ma'am. Mhm.
Nice.
And we have, I keep getting asked to come to Colorado to see the new machinery, and they're gonna finally give me a virtual tour. So I have that scheduled for the next couple of weeks as well. It's the new machinery. It's called a Revolution machine.
Mhm.
It's specifically designed for smaller MRFs to give you more efficient ways to process the recycled material so that we can become efficient and become where we're taking money in, have those scales, and where we can start charging more money and based on tonnage versus like the loads that we're having to do because we don't have those scales. So
Mhm.
everything's looking very promising
Okay, so MRF is an acronym.
for material recovery facility.
Okay. MRF, I like that. That's kind
Mhm.
of, you need a logo, you need a Smurf, yeah, you need a logo or something, yeah, but okay.
We're considered a mini
Or
MRF
mini MRF,
Mhm.
okay.
just because of our tonnage that we're doing right now.
You've done really well with this
Thank
this
you.
year.
Thank
Mhm.
you
Very, very
much.
proud of you. It's very
Thank
good.
you so much. I actually had a meeting yesterday also with the Closed Loop Fund in regards to opportunities for very low interest financing, if that comes. the time, and depending on how we're increasing our tonnage, because we're hoping that everything will get moving along with the city of Roxborough, as well as, partnering counties. So lots of promises
Mhm.
coming down the line. So. Thank you.
Good.
Thank you,
Thank
man.
you.
Appreciate it.
Thank you so much.
I'm impressed. You did
Thank you
really
very
well.
much. Are great.
Good
I
job.
appreciate it.
Okay. Next item,
I think we've
Yeah.
covered EMS
pretty
budget.
covered it.
Mhm.
Yep. So I know Commissioner per year had asked for one additional item for
Yes,
discussion.
I'd like to talk about handicap accessibility at the Kirby
Sure.
in Manager York.
Yeah, we have actually in your project list that we'll be presenting to the board, that staff will be presenting to the board in August, will include, it's for the American Rescue Plan funding. And one of the projects, one of the higher projects in that is a ramp and an elevator access for the Kirby. So right now, our projections for that project are about $125,000 to make both the downstairs level as well as the stage accessible for handicap needs. So that's where we were planning to fund that. We had done in the research on that many, many months ago, and it is not part of your general fund budget. It we thought was a great project for your rescue plan funding. Those are one-time capital needs without recurring expenses. So we were planning to fund that through that unless the board would like to do something differently.
John, do you have anything to add?
I would add that just recently, I've been working with a lift company, and our estimates are coming in a lot lower than our original budget numbers for the ARP funding. So we're probably looking at roughly 23,000 for the lift for the stage and 40,000 for the cargo and personnel lift from the basement to the stage. So
Great.
we're about
When was the Kirby remodeled?
started in 2012, finished in 2016 for the
Okay.
second floor. Has been continued to be remodeled little bits at a time for the last 20 years. In certain
I'm
sections.
surprised that it wasn't required to be done then.
So the requirement is that if you do a full renovation, depending on how much money you put in towards the
Oh.
renovation, I got with inspections, depending on what the price tag is, 20% of that has to go towards ADA accessibility. But in this particular case, every bit of the money is going towards an ADA accessibility project.
So that was planned to come up to us in August.
That's when we're planning to present all of the
American
projects
Rescue.
for use of that,
Okay.
$5 million, I believe you're
Okay.
around at this point.
So if we're going to present in August and it's approved by
Mhm.
this board, when will we see that implemented?
You're probably looking at right now a 6-month turnaround, we're between 4 and 6 months on projects now. This company's kind of specialized, so it may be a little bit quicker, so may be able to get that now.
Do we have to wait till August or can that be in the?
Well,
next-
it's a comprehensive plan of lots of projects for your consideration, and the board had directed us at the retreat to get through the budget process and then bring that funding process, just to not muddy the waters with them, but
You don't want to be
you
putting
wanna-
money back and forth.
right, we
Okay.
just thought we'd wrap up your fiscal year budget and then, start talking about these special projects. These are, the community impact, larger projects, and we thought that was a really good fit
Yeah.
for the definition of use of
Okay, I
funds.
can understand waiting until after if it's not a budget item for the upcoming year. But I will say that I'm committed to seeing those improvements at the Kirby.
6 months seems like a long time from August, 6 months after that to get that done. I mean, that's really pushing that.
It
down
could
the
be
road.
sooner. It's not a staff delay, it's a vendor delay.
So, I mean, this company's been pretty quick, so I'm not saying that I'm just saying typically contractors are anywhere between 4 and 6 months out.
We're seeing a lot of delays right now with everybody.
But this is a specialized company, you know, they did a special thing for us for the last rental. They were here in 2 days.
Yep.
And set us up something temporarily. So I'm sure that they would probably work with us to move that process along.
It'll certainly be completed by dance recital time and have all of that in place, so you won't have that request, after this year.
Have those funds come in yet? They would.
We haven't received the second tranche of something million. We're supposed to be getting it this month.
So this first half, you've
We
already
got in the first half.
identified where that's going.
No,
No,
that's what,
okay.
that's.
All right.
That's the process that we're rolling out.
We're-
At this point,
We
you
that to
have,
work with.
at this point, you've earmarked 2.75 million for broadband.
Mhm.
So that is why I said 5 million remaining. It's a rough number, but
No, it's
We'll be bringing
definitely,
you a budget ordinance or grant project ordinance at your next meeting that will basically replace the one we had done several months ago because of changing requirements by the state. And so what that ordinance will show you is that we have chosen to do the supplanting method because
Mhm.
that's what the state or LGC is recommending to all counties to do. That gives you more freedom to apply those supplanted funds to whatever projects that you want to approve. So it's going to show you that we are using it to cover salaries in certain public safety departments. And then what we'll do is a journal entry back to the general fund so that then it will be in your hands to decide how you want to appropriate that based on the recommendations that come to you in office.
Is it possible to authorize the work to start now if it's going to take 4 to 6 months, knowing that the funding will eventually be there?
You could go ahead and, if this is something that you want to move forward with, you can make that part of this adopted budget. And then once the project, as long as you all decide that you want to cover it with ARP,
The ARP money can come back to the
then
budget.
money would come back in there to cover that. If you decided that you didn't, then you just have to understand that it would be local funds that.
Mhm.
that cover that.
Then I would make a suggestion or a motion that if this is really important, that we get this done more expeditiously than not, that we go ahead and start the process now, knowing that it will be covered. We'll get the money back into the general fund.
So we would put that under the Kirby Theater and Arts line item, contracted services.
so we're
It's
And
not a cap line. is it?
capital.
Capital improvement.
It would be, no. No, because it's more like your maintenance and repair. I mean, because you're gonna contract to have that work done.
Right.
How much,
We're looking at roughly right now, I got a ballpark of $40,000 for the cargo lift and personnel lift in the basement at the top, and then for the 17,000 I sent you earlier, 17,449 or something like
Okay.
that. And I wanted to put a 15% contingency in that because the building's so old. I'm not saying it's gonna cost that much, but that came in at 17. So you're probably be safe at say $60,000.
60,000.
About your 15%.
we can get more close to that
Yeah.
after the meeting, but we can go ahead and put in a placeholder.
Okay.
uh,
So,
we can get that.
so that would be on a maintenance and equipment or
Maintenance and
Probably-
repair.
maintenance repair.
4190.
I'm just looking at you got building and grounds and you have equipment,
And that's just gonna go under contracted service.
contracted services. Okay. All right. Would you like to make a motion on that?
No, go ahead. Your motion.
I got
You
it.
came up with the idea.
No, I was just following up on your lead.
Yeah,
Well,
I've got a note.
all right, you got that in there?
Yeah,
Okay,
and we'll just make that. as
We're
one of
making a
your
motion here
adjustments.
that we want to go forward with this
Yeah.
project.
Perfect.
okay, there you go.
Be approved as part of the budget. Though.
Mhm.
Anything else for us? Are you prepared to mention the two other adjustments and then we can decide if we need another work session or you need that work session to get those numbers
I
together?
don't have those numbers in front of me,
Okay, I can pull them.
but if you give me a second.
I think we had. let's see. You did.
Okay, so we have two adjustments. One is, we need to add some part-time, back to the health department. There was some omission of some part-time costs in there that they had already put in some supporting state revenues for. So it was just an error that we did not fold that part-time cost in. So that's gonna be a total of, including fringes, $16,051 that we need to add back to the health department. And the other is the admin, to the admin department, we need to add funds for that interim county manager contract that is for the next 6 months, at most, hopefully, $4,600.
What was the number again?
So for the health
So-
department.
No,
the
no, I got that
part-time-
one.
Okay,
Interim.
the interim county manager contract for 6 months would be $54,600.
That'd be on the contracted services under administration.
Yes.
Administration.
We hadn't budgeted anything for that, so we needed to come back and make sure we had that covered.
So you had 20,000 already budgeted.
That's for other
That's for
others that
other.
I can pull if you want to look at the details. It's gonna take me a minute to find it. Oh, that's, okay, that's, go ahead.
What?
The lead for North Carolina Tele.
Okay.
Any other topics you'd like to cover?
Do we need another work session?
It doesn't sound like we need another. I can capture these. I think we have 4 adjustments that have been made in an email and send out to you. We'll reflect that in a proposed budget ordinance to have on your,
You need a motion to
Need a-
instruct you to prepare an ordinance.
I do. And then you'll vote on the budget on the 20th at your meeting.
So the result is 310,651 roughly added back using fund balance appropriation as the source to cover that. For the 4 changes.
Thank you.
What part of the money that we're getting from, you'd be paying back?
I'll be paying back for the Kirby, the
Yes.
60,000.
Mhm.
Yeah.
Assuming that, that goes through.
Okay.
Maybe we could change our mind.
Good.
Yep. It's just a plan.
Quick question. Why is telephone expense going up in administration? What's the deal on that?
Let's see.
That's adding thing to the public information officer.
Wow. 48% jump.
Part of it is.
I think it's just going up $115. Am I looking at a different line? The telephone line is third from the bottom. It's increasing by $115.
You talked about in admin,
Admin,
in
Yeah.
admin, it's going up by $965.
yeah.
So a cell phone is $650, so it's adding that. with
Oh, buying the
position.
phone, okay.
And then landline is $445 over the course of the year.
Okay. So we don't lease the equipment, we buy it.
Right.
We just expense it out, it's not capital. I mean, it's not. I don't know if it matters, but there were a couple typos on page 33 and 34. Just, I don't know if it's a big deal.
You'd like to fix this, so thank you.
Well, yeah, I mean, just. Actually, it's just page 34 there too. It says the Diener Center instead of the Senior Center. Line 10, 135,
Okay.
count 100, and then I think, there's another, actually, hold on a second, it's 33,800.
Okay.
And then also at 33,730, the DOT RGP/road grant. Mine's,
That's the rope is
Rope.
correct.
it is correct, okay. I think-
Yeah, the rope grant
Okay.
is correct.
All right.
So Senior center to senior center.
Yeah.
And what was the other one?
The other one
No,
is
I just,
correct.
I thought it should say road and it's supposed to say rope, so what do I know, right?
Mhm.
We will fix that.
And on governing bodies, what is payments to other governments, and it's like $120,000.
This is the ABC payments that we forward to the city of Roxborough. ABC profits.
Okay.
And sales are up due to having that second store in place. So
And COVID,
money's
right, yeah.
coming in, yeah.
So, yeah, I mean, that's like 80, almost 80%.
Right, so there is definitely an offset of the revenue to cover that.
Holy cow.
Okay, y'all done? You happy?
This is your budget at this point. You're the one who needs to be happy with this. Are you happy with it?
I want you to go away happy. I don't want you to go away mad.
Any other questions we can answer while we have staff available?
I do have a question. This has been burning my brain.
Please ask it.
I'm sorry, but I'm stuck on this pay increase or cost of living increase. And from the reports I'm hearing that Roxbury PD is getting a 5% pay increase. Our sheriff's department is only getting a 4% increase. Sheriff's department covers 31,000 county residents and a whole lot more miles than the city does. So I don't understand, well, they'd have a different department of funds, I'm sure, like we're separate from them, I agree. But the sheriff's department, to me, does, by my view, twice the work. I would like to propose that we increase, but I don't think we can unless we do across the board through every department.
Right.
Because it's my topic down there.
That's
Yeah,
legislative.
It's not, no, the city's doing a 5% cost of living adjustment.
No, I'm talking about for county government, if we do an increase in one department, it's across the board. Is that,
There-
is that legislated or?
It is
just local?
not. It's,
So we could change
there's no
that.
law about that. It's more about the morale of the workforce. So
So-
the city is on a different pay scale
Right.
than we are.
Right.
It's not totally apples to apples. We contribute to a 401k for our employees. They do not. There are other benefits that we have that they do not have. So it's hard to isolate just that, but I'm sure that the workforce would be happy to hear
That's
you
the number
increase
one gripe that
that
I hear from the deputies,
from ours,
from our Person County Sheriff's deputies. That's
Is
the
that
number
the-
one gripe.
that the city police officers are getting a 5% COLA and they're getting a 4%.
They would
I
think-
mean, it ain't so much as the COLA. Of course, we would appreciate any and all of it. Just like y'all said earlier, we got people making $15 an hour down in the detention, and we're short.
Okay.
So I don't know at this stage, but that also, they could go to Castle County, which is half the size of Person County, making $20,000 a year more. So I appreciate
What?
any and all that we get, but in this study, we really need to look at that because we're getting way behind.
Yeah.
We have gotten way behind, which it's been 12 to 15 years since we've had a COLA. So we appreciate anything we can get, but it's a lot more that needs to be looked at.
Yes.
From deputies all the way down to the detention.
I forgot that part. Yeah, I've heard about the jailers too. Yeah, thanks for bringing that forward to us.
It just,
When we look at COLA though, I mean, we're not, it's cost of living. And I think when you got one thing looking at cost of living, the other thing is raising
salaries.
salary. And I think that's what we look at, because if, I know for sure, if I was in another department and you said we're calling it cost of living and they're getting another department in the county getting 5% and I'm only getting 4%, what's the difference of cost of living? It's cost of living. But if you
Right.
sit there and you have a salary increase for that particular department, to me, that would make a difference in how it's worded and in the perception of that
Good
Sure.
point.
itself. So that's what I
Good point.
think about.
I mean, I think that helps emphasize the need for the salary study that we keep going back to.
Mhm.
You heard about EMS today, but all of our departments are struggling.
Mhm.
And it does hurt morale when one department gets a special adjustment and the others are waiting on a study. I just want to make sure we understand the need for doing these adjustments for the 400 county employees that we have. The 4% COLA is what is proposed would hit all employees regardless of what department they're in. I'm not sure if the police are doing something different, but I think the city of Roxborough is doing a 5% COLA. I don't know what they have in place for merit pay, but we have that, as well.
You factor in the merit and they equal out.
I mean, potentially a high-performing employee could earn a 7% increase in your upcoming budget. If they got a 3% merit plus the 4% COLA,
Per department.
Mhm.
it's per employee.
Per employee.
Throughout the system.
Okay.
So is there a need to have a work session on Thursday?
I don't
I don't see it.
think so.
No.
Okay.
No.
All right, we will bring back a budget ordinance for approval on the 20th based on the feedback that we got.
Okay.
Anything else from? Okay. We're all set if you
Is
want.
the audience happy? Can we leave before you?
We have to continue the session.
Let's pass on that.
We have to continue the session.
I don't think so.
No.
There's no need for this work session. We'll adjourn.
Adjourn? Yeah, do we have a motion?
I'll make a motion, we adjourn.
All in favor, say aye.
Aye.
Opposed? Thank you.
Thank you.